I got so I just wanted to give you attention. Awesome, awesome. Thank you so much, Ma. You're welcome. All right. When is this ceremony for? Hello, how are you, ma'am? Yeah, welcome. Good afternoon. Oh, you're welcome, Ma. And thank you so much for coming. So we're supposed to what we do now. We might even I just go right into the session with Mr. Bola. Hi. Did you really see what has been going on online in any of the field? Oh, you not. So that means you're not following us on Instagram. Yeah. So we did a lot of online problems, and I know that while we were doing that, we had Mr. Pilot's picture online. So permit me to introduce to you one of our very best clinical psychologists. No other person like what Mr. Bola Pilot will be taking us through a session called the leading burden. The title of the session is the leading burden, how fibroids affect the mental and emotional well-being. So over to you, Mr. Bola.
All right, thank you very much for having me. Good afternoon, once again, everyone. Viewers online and viewers here. It's my personal pleasure to welcome you to a forum like this. I personally take forum like this very, very personal, not because of anything, but because sometimes when we talk about statistics to the other side, really think about it in terms of numbers, but it's very interesting to know that when we talk about these numbers, we're actually talking about humans. And one very interesting thing is how much, as Africans, and I'll say Nigerians, we really don't take our health. And sometimes we do a lot of things around our health in a secret way. You know, we can imagine a forum such as this, and we have than statistics available to us. You know, some research will tell you between 70 to about 80% of African women actually would have the symptoms or have to go through fibroids at one point or the other in their life. Sometimes early onset, sometimes late onset, as it were. So the reality is that it's very much of a conversation that should have a lot of us here. Even young ladies should be part of this conversation because they make people growing up as well. So the prevalence rate of fibroid is something that is also very alarming and interesting. Like I said earlier, about between 70 to about 80% of African women that will have to be diagnosed with fibroid at some point in their life. And in terms of the symptoms vary. You know, it will come as much as every blood flow, sometimes even as due to infertility issues, pelvic pain, pressures, a lot of psychological burden. But the unfortunate part of the care of fibroids again is the fact that, I'll say general care in this part of the world is that we tend to neglect the psychological aspect of this process. So why do I find it very interesting and very important to talk about, which I'll just quickly try to do. Now, imagine somebody having to go through pain, or somebody who have to dress up every day to go out and then having the possibility of extra protective parts. And you know, or somebody who has to go through the fact that, you're not even certain when the flow would possibly happen. Or somebody who is married and then it's affecting childbearing. You know, the list is endless. And you know, you realize that all of these things I've just highlighted has very deep psychological implication. So imagine you being married and then your husband knows, okay, on the period, this period, he says, okay, when are you ending? And then it's ending, and then suddenly he comes and then he says, sorry, I'm still bleeding. You know, so you can just imagine how much this impacts on the global aspect. And you know, one very interesting thing when we talk about the mental health side of things is also that when we get more mental, we usually would think of a lot of negativity around the things, you know, I don't have anything called mental as well. But then the reality is, you can actually, even if the literature will tell you that there's actually no health without mental health, because our psychological health, social well-being, biological well-being, the three intersect in one place, and they intersect at the center, which is our mental health. So the reality is that we cannot but talk about it, because, for example, even if you look at fibroids as a case study, biologically, it's affecting you. That is the biological diagnosis. socially it's affecting you because, for example, you might decide because of the heavy blood flow to even stop attending certain events because you don't want the embarrassment of getting served on your food or things like that. So it's that and even making of people attend certain social events. So socially you're not functioning. Then psychologically, it starts to affect your self-esteem. It makes you feel like, oh, am I the only one that's going through this? Are there other people going through it? What makes me different? Why should I be the one having to be diagnosed with fibroid? So the reality is that it affects your global well-being, as much as it does fibroid, but it affects your global well-being. So the truth about something that's very important for us to talk about, those are very, very interesting. And some of the basic psychological symptoms that you are likely to experience, or people might likely to experience, are things like anxiety. And sometimes even the anxiety is not even in condition itself, anticipation that this will likely happen. Or you suddenly go out and then you suddenly feel this strange feeling around your body and you just feel like, oh, this is not going to go bad. I once had a senior colleague because that's one of my lead experience, which I always use as a point of reference. There was a period where she had two boys and then she had fibroids, and we realized that she was very sweet person, but you realize that she's constantly very irritable all of a sudden. She comes into the office in the morning, she's irritable, she's acting weird, everybody's wondering what's going on. So it took us a while because we are close and she just started to think that she's been having inconsistent blood flow. And sometimes she doesn't already without pads or anything, and she's also comes out of nowhere and things like that, which is one of the symptoms of fibroid. And then after a while, she had to go through the procedure, and you realize the remarkable difference. After she went through that procedure, she became back to her usual self. She comes into the office smiling and things like that. So for me personally, the emotional side of fibroid is something that we cannot talk about if you're going to be able to go through it in terms of a realistic way of treatment. Thank you.
Okay, thank you so very much. That was really insightful. I don't know if you have questions. If you have, for while you're trying to get your questions, and if our online audience, you have questions, please drop your questions on the comment section. But while we're trying to get the questions, I would ask that what would you be your one-line sentence for someone who has really been excited about the portfolio and the person is probably watching online and the person is like, what is that one word that I'm going to take away from Mr. Pius today?
I think I would take even more than the word to kind of express it within sincerity because when we have forums like this, it's just in our nature as Africans to not embrace things like this. Quite unfortunate, to be honest. And why do I say that? Because this sort of like forum gives a lot of free information. It's like free consultation, and you realize that it is endless because we can ask questions there and we can provide answers. And then you can imagine, like I said, three areas or three aspects of your life that is tripod. You've been affected by just one. So imagine, yes, we're talking about biology now, but it's affecting your social life. Because as humans, I usually would joke around and say that we're like social beings, yes, but we're like transformers. Because the energy we transmit for us physically present here right now, we are bouncing off each other. So it's like an electric charge that carries each other. But imagine because of fibroids, suddenly we grow from a social environment and then go inside and say, oh, I don't know what this thing will make me, this embarrassment might cause me to do. You need that, oh yeah, you're trying to get into relationships and then your partner is thought to go, at some point we get into a situation of sex. So what happens? Oh, I'm going through this. Oh, I don't want to get into that. So you can realize that it's a global problem, but it seems just so small, very, very global. So for me, I'll say to us viewers here as well as online, that we should treat as much as possible. We should take forums like this very, very seriously. And we should just come and ask questions. Knowledge is something that you can't get enough of. It's something you can't get enough of. Sometimes you realize that even the major part of your fibroid diagnosis is not the diagnosis itself, it's the anxiety around it that comes with it. Oh, what happens? Oh, they said, oh, and sometimes all of these things are sometimes unique that they don't even hold facts. So when it comes to problems like this, it makes it more interesting to learn and at the same time also pass on knowledge. Like one of my mentors always tell me, the beauties of things we do around the medical space is that it's still done in a lot of secrecy. But the more you open it up, the more people get to know, the more knowledge, and you get even the state of fear that people have generally around it. So for me, it's just the lessons to take away. Thank you.
Thank you very much, sir. Do you have the questions now? What about online? Do we have any question online? Okay, I have one more question for you, sir. Practically, for someone that, like, you're probably still watching online and there is one big person is here in the room. But practically, the person is asking, probably going through pains right now, or just has this maybe her period or something that it's just the dilemma that she's dealing with, something like the situation she's dealing with, and it's getting to her even in terms of her work practically. What will you say to that person listening to or watching or before?
So the beautiful thing is when HIFU center by Novica, Nigeria, and when you send one of our centers here. I would say one of the very first things you need to do if you have a mental health condition is have a comprehensive assessment. Because if you have a comprehensive assessment, then you would even know the nature of the problem. Like I said, anxiety is one big killer. Oh, I have this, and then you're thinking, and then you spiral. And the beautiful thing is really God has wired us with our minds. It just keeps manifesting and it just keeps creating the 3D images, and you continue to see sides and shades and things, and you're like, oh, this is work, this is work. But if you come for a comprehensive assessment and the comprehensive assessment is done, the doctor will then tell you the best possible option, what you can do, what are the chances, and you realize that it can eventually, by that first time having a comprehensive assessment and done, and going through the procedure and treatment, and eventually get to a point where you are likely to start to do your dreams and aspiration. And the truth about it again is this: the people who come in for private care, do they really get it? So like, in primary rooms, people do the job, total quality for the emotional well-being of the individual. And by that, it just typically gets people to be able to get work. So the realities are that as much as possible, if anyone is able to come in for the comprehensive assessment and go through the process, there's light at the end of the tunnel. Thank you.
Okay, thank you very much, sir. So if we're going to now take it back to people who generally, not necessarily fibroid here, right? So we don't want it to just be that we're talking about the fibroid. I know Nurse Joy is going to come and take us through that again, right? But I also want us to address for those who are just dealing with health conditions, what would you say in terms of emotion, in terms of?
Emotions are sometimes very, very intangible, not seen, but it's quite powerful. Just the same way I'll tell you that the mind controls a lot of the things we do. Now, the mind is a complex place of interaction, and it's usually an interaction between your past experience, currently what you're going through. And the truth about it is that if you're going through anything emotionally, the best way to go about it is to seek the help you need. There's really no harm in talking. It's just in this part of the world where we sometimes would think that talking or expressing is a sign of vulnerability. But I usually would say people that vulnerability to me, the moment you come to an awareness of a sense of vulnerability, it stops being vulnerability. It becomes a sign of strength. So being vulnerable does not necessarily means that you're weak. Oh, I don't have the capacity to go through this. Talking about it does help. Like there are a lot of uncertainties around us since 2020 till date. There's still the Strait of Hormuz somewhere. There's still this. There's still that. And the realities are that this is the world we live in. And these uncertainties are things that would naturally create an emotional reaction. Because you're uncertain of, oh, even because of fuel in Nigeria, we've been dealing with that the last 3-4 weeks. That has impacted a whole lot of people, impacted businesses. And that's the reality that faces us. But coming out to talk about some of these challenges sometimes has a way of helping. Like I said in one of my comments earlier, we're social beings. So if you're able to connect and charge each other in a positive way, it also has an impact on our emotional state as well. So you can't be in silence, being alone or being in a state of loneliness and expect that things will transform. And that's one of the reasons why for older people, it's usually recommended that you don't keep them lonely because the loneliness in itself can actually even kill them beyond any physical health condition.
Thank you.
Okay, sir. Thank you very much. Do we have any questions yet? Okay, but I think I have two more questions for you just before you leave. You just took me to a word called loneliness. So what would you say about people who are dealing with that hidden burden, right? That those, and then they are not even speaking up. They're not even probably, they're reading, but they are not able to take the right decision. What would you say?
So one thing, like I said earlier, is you have to be able to express and understand that vulnerability is not a sign of weakness. Because there's not how we want to say emotional problems are things you have to be vulnerable with. You have to be able to share. You have to be able to talk to somebody about. So imagine somebody who, for example, pardon me, I'm a Christian though, but we know how our Christianity is around here, where you've been diagnosed with fibroid, for example, and somebody is telling you the spiritual problem, or somebody is telling you it's because something has happened somewhere, and that's why you can pray it off, and it will shrink, or you can do this and everything will be fine. Even sometimes some of those comments, like I would say to people, sometimes when you don't have the right words to say, please don't say anything to somebody. Because even the words you would say sometimes can push the person even to that state of loneliness. So it's usually better if you don't have anything to say, just refer to a professional. Just say, okay, I think I know somebody that would be best to help you here. Because for somebody going through, for example, grief, and you're just telling the person, it's okay, it's the will of God. It's in the context, because as Africans, it will seem like, oh, that's a soothing word, right? But the truth is, it's not a soothing word. Because for somebody who has just lost a child, and you're telling the person is the will of God, how? So in reality, you have to be able to understand that sometimes you have to encourage people to come out, and you can't. The reason why we all have our sense of profession is not because we just want to be professionals, it's because we are here to help people. And that's one of the reasons why for me personally, doing what I do always brings out me talking, and I just love doing it because I know that people are out there going through a whole lot, and expressing it sometimes will be the problem, but giving a safe space, which is one of the things therapy will do for you, is very, very, very important. So loneliness is really, for me, I'll tell people, you can look at the statistics of people who retire around 60, 65, and maybe they go to a remote area. You just hear suddenly that something happens and they're gone. Why? Because the body system is already used to a certain state of engagement. And suddenly you just throw the person to a state where it may literally not bounce off any other person's energy for maybe a whole week. It's just there by himself.
Wow, amazing. Thank you very much, sir. So my final question. Yes, just before we call, I hope we're getting ready for Nurse Joy. She's coming to give us a presentation on all that you need to know about hair. Okay, you have a question. Okay, sir. Well, I think we should take your question before my final question.
Yes, I don't know why is it that Nigerians especially, we don't like talking. And we don't think about the psychological effect of, for example, fibroids. We just think it's a matter of, I have fibroids, it's either I'm removing it or I'm not removing it. We even ignore what is causing to us. You've said so many things now. You can lose your confidence, you can go in, but we don't think about all that. And I think there is also another condition like fibroid that's called acromegaly. That's even worse because most of the time it's either misdiagnosed or undiagnosed, and people carry this for a very long time. And even sometimes, even when it's fibroid, it's been diagnosed, but you're afraid of surgery, and you're bleeding like I don't want to use the word, and then you are not doing anything about it. And still, when you ask most of those people, please, do you want to see a therapist? The regular answer is usually no, I don't need one. How can we make sure that we open ourselves more?
I think it's through forums like this, to be honest with you, sir, because we need to keep advocating. I'll give you a typical example. Now, and I'm sure from experience, you would attest to this, sir. Tell anyone that, oh, I've just gone through your test and the scanner and everything, and I think you have fibroid. The first instance reaction is, God forbid. So sometimes a lot of our religious beliefs also has a major role when it comes to health diagnosis generally. Because even people just saying, oh, you have hypertension, you can manage it with medication and with this. The first thing you would see is a form of resistance. One part of it is naturally human, which is if anybody is confronted with anything difficult or challenging, the first natural response is to want to rebuke it or be defensive in the context of it, say, no, no, I don't have it. But it also depends on how we then introduce it. You know, sometimes rather than saying, oh, you need to talk to or see a therapist, because so we have somebody that you can also talk to, which emotionally just to share. Then again, why are we still like this in Africa? Sometimes it's also how we've lived through a lot of myths in life. Like I said to you, sir, some people will get that diagnosis and they'll say it's a spiritual attack. Oh, you're bleeding a lot. Oh, it's your enemy. They are conjuring something inside of you. That's why the result is the bleeding that you're experiencing. And you know, it's easier for us to believe those myths than somebody telling you that, okay, by the time we remove it, you have a better life, everything goes back to normal. But the more we come out with testimony, that's why I had to share one of my own senior colleagues' testimony. When she was in that active phase, she was extremely irritable. This is a very sweet person, but she was extreme, it was affecting her global life. Even when she had some time to even do her job, she couldn't even do it. Parenting her kids, maybe not really there. But it was until because she was a professional person, she knew what she needed to. She had to go in for the surgery, and she just planned for the surgery. She had it. Even going through hysterectomy sometimes, the result after does not even sometimes equal even like the in terms of the overall burden reducing, yes, biologically, but the psychological impact because your uterus is gone. How do you deal with that? Imagine that happening to somebody who is marriageable age, for example, or even in a relationship, for example, or who has just gotten married, for example. So the psychological impact is actually endless. But the only way we can help ourselves is to keep advocating through forums like this, educating people, letting them know that the service is very much confidential. It's not something that you would hear about or you see somebody talk about it somewhere else or somebody would print your name somewhere else. Generally, healthcare is confidential. And until we understand that, we may not be able to go far. You know, and then maybe we also have to sensitize people even using our religious pastors, let them know that the reality is this condition can be cured without even having to go through fasting. We've seen condition where people will tell you, oh yeah, this condition that you're going through, you're going to fast. And fasting in itself will now impact on the health condition. And then the person might even get to a state of crisis. And if something else happens, they'll say it's the enemy. That the fasting came late or the intervention spiritually came a bit late. So they caught up with him before, you know. So there are a lot of things that we have to be able to delineate and dissect and be very open when we talk about these things. And that's why I use the word vulnerability. Because in Yoruba parlance, they will tell you that if you're going somewhere you don't know your road and you ask people, you won't get lost. But it's when you don't ask you have chances of getting lost. And that's why this that we're talking about, some people could have easily maybe gone through surgery or HIFU, for example, but because they don't want to talk about it, they have to then end up doing hysterectomy. I've seen somebody who was sharing an experience at that time, it was quite small. Let's just quickly do it and get it done with. But like, no, I can't do it. The person came out like 15 years later, still no child, still nothing, and had to do an hysterectomy. So you can imagine that. And I've seen people again just to share testimony. Oh, they said, oh, you had fibroid. The best thing is remove it. The surgery was done less than 3 months later after healing. The person was pregnant. So we have to also share these positive testimonies as well. So it's not about the negatives. Let's also share the positive testimonies and educate people. And I'm sure that would also help us a great deal. Thank you, sir.
Yeah, I still have one.
Okay, sir.
And this is about which we don't, things that we don't talk about. People who are fibroid. Some people have become dependent on analgesics. We never talk about that. Sometimes the analgesics are not the common one.
Yeah. The very high end ones.
And but nobody talks about it. And it affects their quality. So even sometimes, even when you are treated with fibroid, there's a bigger problem.
Independent.
Dependent And this kind of forum should also be able to help us to bring such things out.
Yes.
Because unless you let us, you tell your doctor about it, and when somebody is dependent on something, they can defend it with their life.
Yes.
They conceal it.
Yes. Yes.
They don't let you see it.
Yes.
But it's also affect your quality of life.
Absolutely.
So I think it's one of the things that we need to also say to people. One, you can avoid that dependence by treating the
underlying condition. Yes.
And if you are falling into that net now, you can still get that.
Absolutely.
Yeah. So
absolutely. Yeah. So I think for me, the beauty of what we do within the medical space is that the treatment is quite usually very much holistic. We have to go through all varieties of medical personnel to get the holistic treatment. One of the things you just mentioned now is that even for people who are going through pain, one of the very easy things you'd understand is that there's always a codependence, because they will then be dependent on, which is what we'll describe as a maladaptive way of coping, because by the time you then take away the primary source of the problem, there's another secondary problem, and that secondary problem can then create multiple other problems, which is the reality that we need to also talk about. So sometimes, even when you're managing this condition, it's not best to just possibly go to, forgive me, like chemist. I wouldn't say pharmacy, I would say chemist, right? To just say, oh, let me get some analgesics. Those people would sell to you because they're not even going to inquire why you're buying, and they want to make money. So they will sell to you. On the long run, it creates a bigger global problem. We've seen people who are even medical professionals who end up getting dependent on some of these things as well. So it's something very important to also highlight. Thank you, sir.
Thank you very much, sir.
Thank you.
It's been a very insightful session with you. But while you were speaking, I heard you mention use a lot of words, and I'm very sure that some of our online audience are wondering what's this word about. You said HIFU. I don't know, you mentioned a lot, hysteroscopy, like so many things, and I'm sure everyone is like, what's going on? Because we've not seen the doctor, we've not seen the nurse, right? And then you're talking about hidden fibroid. Right. And so exactly why I'm going to this question, I have two in one question. I know a lot of people say, because we posted something some time ago online, and someone commented and said that she used herbs and she was good. What would you say about this temporal healing versus what you're trying to talk about now? Because I know you really have to tell us what is HIFU, because you mentioned it and we don't know. So please, can you just tell us, finding where Nurse Joy comes to?
No, don't worry. No, I will answer the very first part, but I'll leave that to the other part. And I'll tell you why quickly.
Okay.
Now, when we talk about this healing, herbal healing, the truth is that as Africans, we wouldn't say that before Orthodox treatment came in, maybe there were not other things that were being used, right? So we'll leave that at that. But let me ask again, this person saying I used that, was the person diagnosed, or the person was just having certain symptoms and felt like, oh, this looks more like fibroid, so let me use these things, and then maybe it stopped? Usually we tend to downplay sometimes Orthodox treatment, but I'll tell you the truth. Even in the case of some mental health conditions, which I have seen, I have one which I'll just talk about very briefly. Typically, this person is going through a state of mental distress, typically. But the parents are very strong religious people. I'll try not to mention the name of the church. And this girl had to be pulled out of school, first class student. Had been pulled out of school, and she's been seeing this general overseer. I think they've had to book appointment like 3 or 4 times because the parents are a bit connected. And they've been saying these things are spiritual. And I've constantly sat with this girl. And I can tell you that if we had done some of my recommendation in terms of what I was proposing that we do, there's a very high chance she'll be back in school now. But as I speak, she's been out of school for over 6 months. And she's just at home. And I'm not saying the spiritual fathers don't have powers, right? But even the fact that we could even use medicine to provide solution is also a miracle. It's also a miracle, which is the truth. So the thing for me is I'm not downplaying the herbs. But get a diagnosis first. And after that diagnosis, go through the treatment, go through the healing. Because even the healing, this is where the mind becomes very powerful. Even the healing, we've seen people who have been healed, and because of their mindset, they still believe they still have the condition. And they're living like they have the condition 100%. I've seen a case like that, believing that she has cancer. All the tests were done, everything was done, treatment, everything, nothing. But this woman kept living and saying that she had cancer. She was living her life like someone who had cancer. So it's also very important we talk about some of these things as well. So I'm not ruling that out, but the truth is, get tested, get diagnosed, get treatment, and you'd have a best quality of life. Like I said, after the treatment, sometimes people are able to attain, like cases have used, best quality of life that they want, even maybe even better than before the treatment itself.
Okay, thank you very much. We're going to take a short break right now, just so we'll play a video. We have a video that we want to play for you. So while we're doing that, thank you again.
All right, thank you, everyone.
On TV now. Yes, because of our online audience. I want them to see you.
Hi, good morning, good afternoon, good evening. My name is Aisha, and I would like to share my HIFU story with you. Well, in 2020, I was diagnosed with fibroids. I couldn't take the news because it wasn't one, it wasn't two, it wasn't three, it wasn't four, it was actually five. And the two largest were between 9.5 by 8.4, while the second largest size was 7.5 by 6.2, I guess. Then every other ones were smaller sizes. It was a journey of oh, pregnant woman, sorry, be careful there because I have a bulky stomach. It was quite noticeable when I'm coming. And I hear people say, be careful there, you you're pregnant and others, but I know that I wasn't pregnant. I really wanted a solution, and that was when I started my fibroid journey. I visited different hospitals, recommended by friends and families. And I remember very well when I finally made a decision that, okay, I'm settling with so hospital. I said within myself that I'm ready. So I met with my boss and I discussed with him that I would like to go on leave to take care of myself. And he was shocked, like, oh, in this age and time, you want these options when there are better options. And I was like, no, that even when my mom had hers, because my mom was actually diagnosed with fibroid back then, but we finally lost her. Ours was even quite pathetic because it was heavy flow, and the menstrual days were like 7 days or more, I can't remember. And it's quite Hi, good morning, good afternoon, good evening. My name is Aisha, and I would like to share my HIFU story with you. Well, in 2020, I was diagnosed with fibroids. I couldn't take the news because it wasn't 1, it wasn't 2, it wasn't 3, it wasn't 4. It was actually 5. And the two largest were between 9.5 by 8.4, while the second largest size was 7.5 by 6.2, I guess. Then every other ones were smaller sizes.
You're still going to watch it. There's no way we are going to watch it. We actually have it in our agenda to play with for you. But we need to get on to this that Nurse Joy has for us. She's our HIFU nurse, and she has so much that she has prepared to tell us, so that by the time we play the video afterwards for you, you will put a meaning to it. So permit me to make welcome no other but our HIFU nurse, Joy. Nurse Joy, you're welcome.
Thank you so much.
How does it feel like being here?
Well, it feels good. Good afternoon, everyone, and good afternoon to our online viewers. We recognize your presence. I would also want to recognize the presence of a very important person that is here, and that is the medical director, Dr. Abayomi Ajayi. Yeah, you're welcome, sir.
Yeah.
So Dr. Abayomi Ajayi, I'll talk about him briefly. Yeah, sorry to deviate, just briefly. So he's the medical director of Medical Fertility Center, Lagos, Abuja, and Asaba. And it is interesting to know that Medical Fertility Center will be 23 years just in 2 days. Yeah, and he's also the medical director of Fibroid Care Center, Lekki, Lagos, and Abuja. So you're welcome, sir. I'm sure you're going to hear him speak. Yeah, I'm very sure of that. So now we can go into the HIFU presentation. I know a lot of people are out there waiting to hear about HIFU and all. So we are going to do a brief touch up on fibroid, what fibroid is all about, before we talk about the treatments for fibroid treatment options. She already introduced me. My name is Nurse Joy, a HIFU nurse here at Fibroid Care Center, Lagos, Lekki. So the topic of today would be fibroid and your options, non-surgical solution every woman should consider. So what are fibroids? Well, I'm sure you're going to say, okay, yeah, the slide is on now. Fibroids are also known as myomas, and they are non-benign tumors. That means they are not cancerous tumors, and they affect about 33 to 77% of women globally. And it is estimated that about 70 to 80% of women, they will have fibroids in their lifetime. That's a lot of percentage. So that leaves just about 20 to 30% free. And about 15 to 30% of these women, they will suffer from symptoms. I would call this person Mrs. A. Mrs. A looks pregnant, but she's not pregnant. She has fibroid. So a lot of times you see women who looks pregnant, but they're actually not pregnant. They have fibroids. Next slide, please. So overview of fibroids. So this picture helps us understand the various classification of fibroids. And most of the time, the location of the fibroids will determine the symptoms of the fibroid. So fibroids are usually classified into three: subserosa, intramural, and submucosa. So from the picture, we'll see the subserosa, the ones that are outside, towards the outer part of the uterus and outside. We have one called pediculated serosa fibroids. It just has something like a branch, so it's outside. Then the intramural is the one that is inside the muzzle. Yeah, the one just inside the muzzle. Then submucosa is the one pushing into the lining of the womb or inside the womb. And most of the time, the submucosa, the one inside the lining or pushing into the womb, those are the ones that would usually interfere with fertility, cause heavy bleeding and miscarriages. While the ones outside, which we said they are the subserosa, they could cause pressure symptoms like you hear a lot of some women say they have urinary frequency and urgency that could cause that, then constipation too. Those are some of the symptoms it could cause. Next slide, please. Well, what causes fibroid? Little is known about the exact cause of fibroids, but it could be linked to hormones and genetics. The incidence increases with age, peaking in the late 30s and early 40s. But the truth is that we have younger women who have fibroids, but this is just the peak incidence rates. And it's higher in Black women. So being a Black woman predisposes us to fibroid. Family history of fibroid is also a very strong history as well. Lifestyle, obesity, early periods, that's early menarche, late menopause, and women who have never given birth before. These could be risk factors. Next slide, please. So what are some of the common presentation, people who have fibroids, what do they usually present with? Well, the truth remains that some women have no symptoms at all. So we call them asymptomatic. So they just have the fibroids and they are still cool, going on with their normal activities. But some people have urinary frequency, constipation, painful periods, dyspareunia, that's painful sexual intercourse. Some people have long-term abdominal vaginal discharges. This could be because the lining of the womb is also already altered, so they could cause some form of irritation.
Recording in progress.
And they could have abdominal enlargement. You see them, they look pregnant. They could have pelvic pain, back pain. So these are some of the symptoms of fibroids. So how are fibroids usually diagnosed? Through history taking, pelvic examination, ultrasound scan, MRI, sonohysterogram, hysteroscopy. These are some ways in which fibroids are being diagnosed. So the treatment of fibroids is usually dependent on factors like the severity of symptoms, desire for pregnancy, age, and location of the fibroid. So all these could influence the treatment options for fibroid. Next slide, please. So some of the available options, one of them is open surgery, which is AKA myomectomy. It's the most popular and commonest among all of them. Next slide, please. Yeah, so these are other options for treatment of fibroids. Endoscopy. We have under endoscopy, we have laparoscopy and we have hysteroscopy. So for laparoscopy, they're just incisions, little incisions made on the abdomen, and the fibroids are taken out, although this would not tackle all kinds of fibroids. Hysteroscopy too is also a procedure where a camera is introduced into the uterus to see, and tiny instruments were also introduced to take out fibroids that are inside the uterus. But this would also not tackle all the fibroids, especially the ones that are outside, because this could just see inside the fibroids. Next slide, please. This is another option, uterine artery embolization. Next slide, please. So what are the common complications of open surgery? I know a lot of people would be familiar with this topic, complication of open surgery, because they might have had friends who had open surgeries and they might have learned from them, heard their experiences, family members. one of the most common complications is could be anesthetic complications. Well, some people may die from surgery, maybe not because of the surgery itself. It could just be because of complications from anesthesia, infection, heavy bleeding. Blood transfusion is usually required for open surgery, and sometimes it could be additions, scar tissues after open surgery. You could just see that the lining of the uterus is glued together. That's another issue. And maybe additions outside the uterus too, the uterus binding to organs like the bladder, the intestines. So this could happen from open surgery. Then embolism, that could be very bad and sometimes could lead to death. Hysterectomy. Sometimes we might have had cases of people who go for open surgery and at the end, they end up taking off their womb completely, maybe because of heavy bleeding or other complications that would have arisen from the surgery. And reoccurrence too is more common with after open surgery. Just like this. So today, we are going to be talking about HIFU that we've been hearing. We've heard that a lot of times. So HIFU is a non-invasive treatment for fibroids. So that means non-invasive, there's no cuts anywhere. So how would that happen? So HIFU, for long, not for short now, it means high intensity focused ultrasound. I'll usually describe it as treating fibroids without a knife. So let's see how that happens. So how does HIFU work? We're going to use this picture to still understand better how it works. But high-intensity focused ultrasound is a non-invasive technique, uses non-ionizing ultrasound waves or heat to ablate tissues. So this means that the ultrasound waves are usually converted to heat. And what does that heat do? What does it do rather? It destroys ablate tissues, okay? So that means the tissue we're talking here is the fibroid, the fibroid tissue. So it destroys the blood flow and the blood supply to the fibroid. If we look at the picture, we'll see that HIFU is a targeted treatment. It's targeted in the sense that let's imagine that this sun rays is the ultrasound wave, and we have like a magnifying glass here. You could see the rays converging at a particular point known as a focal point. So that's how HIFU works. So the ultrasound wave also converges at a particular point, which is a focal point, and that focal point will be on the fibroid. So we are not scared that the rays would go to surrounding organs like the bladder, the intestines. We are not scared. So it's a precise treatment. So HIFU uses heat energy, again, to destroy the fibroid tissue and the blood flow, the blood supply to the fibroid, then it leaves it dead. What happens after? Well, we'll get to know later what happens to the fibroid after. Let's go on. Yeah. Okay, so this is a picture that explains what happens actually after HIFU procedure rather. If you take a look at the picture closely, this picture and this MRI image is from one patient. So it shows the what it looks like, what the fibroid looks like in the first picture before HIFU intervention. Then the second picture shows that the fibroid now has begun to, if you check the color here, color differentiation here, it looks grayish. Here it looks dark. That means the blood supply to the fibroid has been compromised. It is dark. So now the body's immune system now comes to play. There's a dead tissue in the body. What does it do with it? It wants to try and remove it. So it shrinks over time, like body absorbs them. So it begins to shrink and reduce in size. If you look at the next picture, same fibroid, you see how small. And if you compare it to the last fibroid, it's almost not there. So that's how HIFU works. So it keeps reducing, shrinking over time until you find relief from symptoms. So usually as the fibroid begins to shrink, most women will experience relief from their symptoms within the first 3 to 6 months post HIFU treatment. Some women as quick as the first 1 to 3 months, they start to express significant relief in symptoms. Some, it could be the abdominal size reducing, it could be heavy bleeding. So they find relief in whatever symptoms they presented initially. So this is how HIFU works. Next slide, please. So this is what the HIFU machine looks like. This is our theater, our HIFU theater. This is what it looks like. So this is like the control station, and this is the HIFU machine itself. Okay. So, well, is HIFU a new technology? No, it is not. But in Nigeria and West Africa, I am very happy and proud to say that Fibroid Care Center is the first in West Africa to have brought this technology. And currently in Nigeria, we have just 2 centers, Fibroid Care Center Lagos and also Fibroid Care Center Abuja, and we've been operating since 2021. But there are other countries who have been doing HIFU, so it's not a new technology per se, but maybe in this part of the world, in Nigeria rather, I would say it's relatively new because a lot of people are still maybe not aware, or they are still thinking about it. Is it real? Is it not real? So it's not a new technology at all. So we have a lot of countries that have been using this HIFU technology for treatment of fibroids. You can see Russia, China, Spain, Italy, Egypt. Of course, Nigeria, I'm proud to say it's Fibroid Care Center. So next slide, please. Okay, so this slide just shows like a global record of HIFU treatments that have been done up until data stops at 2022. This data was compiled in June 2025. So over 3,000 cases of 300,000 cases of fibroid treatments have been done. And if we see in 2010, we just have about 3,607. So it keeps increasing. So this means that people are getting more aware and then utilizing this treatment option. Next slide, please. So the question is, who qualifies for HIFU? Is it just everybody or anybody that has fibroids? Well, we'll get to find out. So patient diagnosed with uterine fibroids and adenomyosis. We'll be talking about fibroids. It is also interesting to know that HIFU does not only treat fibroids, it also treats adenomyosis. And adenomyosis is quite common. And some people who have fibroids also have coexisting adenomyosis too as well. And it's a very fantastic treatment for adenomyosis. Another option available for treatment of adenomyosis would be hysterectomy, taking out the womb completely, of which most women will not want to buy that. So HIFU, it's a very potent treatment for adenomyosis. And we've done a lot of cases of treating adenomyosis using HIFU. So yes, so people who have adenomyosis will benefit from this too. So abdominopelvic imaging showing a safe acoustic path. So this is very important for qualification of for HIFU treatment. So before the HIFU treatment is done, we want to check, we do what's called a stimulation to make sure that the acoustic pathway is safe. I will just explain it plainly. What it simply means is that if you take your mind back to that image that we used to describe how HIFU works, that has something like a sunlight that we said we're going to refer to as a rays, then a magnifying glass, then converging in a focal point. We want to make sure that at that point of converging, there is no additions. There are no, there's just nothing on that way that would disrupt that pathway where that heat energy is going to pass through. Well, for some people who might have had maybe surgeries in the past, it could be an abdominal surgery, it could be previous open surgeries that maybe they had a recurrence and they want to have HIFU treatment done. Of course, we want to make sure that because we know the risks of open surgery, which we mentioned earlier, and we said one of those risks could be adhesions. So that could be a risk. So we want to make sure that the uterus is not adhered to any organ. So it is very important to make sure that the acoustic pathway is safe so that you're trying to rule out any risks for injury. Then people who are not capable of tolerating surgical procedures, the people who do not want to hear about surgery at all. They just don't want to hear about it. For any reason, it could be past experience, family experience, they have friends who have died, they just don't want to hear about surgery. Then people who are not fit for surgery, there are people who are not fit for surgery. Then people who do not have symptoms, but they have psychological burden. Yeah, so that's what the psychologists talked about extensively in the first presentation. So there are people who do not have symptoms actually, but they thought that they have fibroids, they just can't live with it and they want to do something about it. So they also qualify for HIFU treatment. Next slide, please. Next slide, please. Okay, so in preparation for HIFU, so before HIFU is done, we want to confirm that the patient is suitable for the procedure. And then that includes having an MRI. So MRI is a very important part before HIFU procedure is done. So MRI helps to do, I would usually describe it as 3 basic things. One, it helps to it tells us the exact number of fibroids. That's 1. It tells us their exact location. That's 2. And it also helps the doctor to plan the treatment plan, because treatment plan is usually individualized. Yeah, so MRI is very important. Then there are some blood tests that are usually done to make sure, which includes infectious disease screening and some other blood work, just to make sure that the patient is fit at that time for the procedure. They will also want to rule out some contraindications, like, okay, is the acoustic pathway safe? Can I go ahead with this treatment? So that could be one contraindication. We'll get to see some others as the slide goes on. So dietary preparation is very important. So before the HIFU procedure, about 3 days before, you're told what to eat and what not to eat. Then bowel preparation is also done in form of giving laxatives, and we do enema because we want to make sure that bowel is completely empty. So these are some of the preparations done before HIFU treatment. So this is absolute contraindications for HIFU treatment. I would want to take your mind back that we said that HIFU treatment itself cannot cause cancer, okay? Because we mentioned that it uses non-ionizing radiation for treatment of fibroids, so it cannot cause cancer. But people who already have fibroids that are suspected of malignancy, we wouldn't want to treat them. So that's why MRI is also very important. So it tells us, oh, this fibroid looks suspicious, or it doesn't. So people who have fibroids suspected of malignancy, you wouldn't treat. Then people who cannot lie in a prone position for about 1 hour, maybe because they have issue with their spine, because they're going to be lying still for about 1 hour. So those people too, we would not be able to treat them as well. So why choose HIFU? I would also like to talk about this picture. You can see one man standing out of many options. So that man is called HIFU. Yeah. So why should you choose HIFU? Well, it's a day procedure. You get to go home that same day. So you just need about 2 hours recovery time. Then you go home that same day. We said it is non-invasive. So there's no cuts. So because there's no cut, it is uterine sparing. So we're not scared of, okay, I'm going to have additions from HIFU. The lining of my womb is going to be scarred. No, it is uterine sparing. Unlike open surgery, where you have to, I will usually say cut and sew. It's not done in HIFU because you're not even making any incision at all. Then precise ablation to target area. So I'm not scared that, what if there's no what if, is a precise ablation. So the target area is the fibroids, where the fibroids are. So you already have a map, so to say, like a blueprint that you're working with. So it does not affect the normal uterine tissue, not at all. And it also allows for normal vaginal delivery in future pregnancies. Because there's one question a lot of women ask. Would this make me have cesarean section in the future? Not at all. It allows for vaginal delivery. If cesarean section is recommended for a woman after HIFU, it is not because of the HIFU treatment. There are other reasons why cesarean section may be recommended. So no general anesthesia is needed. So we are not scared. We are not scared that, oh, okay, there's going to be complications from anesthesia, and faster recovery time. A lot of women would return back to work in a few days, as early as 3 days after HIFU procedure. So the recovery is very fast. So next slide, please. Okay, so these are other advantages. We already talked about the non-ionizing radiation. So because it uses non-ionizing radiation, if the procedure needs to be repeated in the future, it can be repeated, and there's no damage to the ovaries. Remember, if you know the anatomy of the uterus, you know that the ovaries are just hanging somewhere close to it. But because HIFU is a precise treatment, we're not scared that there's going to be any damage to the uterus. HIFU is cost effective, really, really cost effective, because if you take out the hospital stay, especially in some places, I would say like Lagos, it's not easy to pay for hospital beds. They are usually expensive. We're not using blood transfusion, and it's safe. HIFU is safe. Yeah, I'll say that again. HIFU is very safe, and there are lower risks of complication compared to open surgery. So does it mean that HIFU doesn't have complication on its own? Well, HIFU is generally safe, but there could be potential complications that are usually mild, like temporary lower abdominal pain. Some people complain of abdominal cramping. It's usually mild, and it doesn't last, so it wears off quickly. Then some people would have abnormal vaginal discharges, which usually wears off quickly too, as well, and just takes some couple of weeks. It's normal. And skin burns or blisters. So skin burns or blisters could be a complication from HIFU, but I would say that I have never seen that happen in practice. So just in theory, yes, it could happen. So this is because just not everybody will do HIFU. The doctor who does HIFU is a HIFU specialist, and he knows how to prevent skin burns or blisters from following HIFU procedures. Yeah, next slide, please. So this is a skin appearance after HIFU treatment. Remember we said that the HIFU is going to use heat energy, destroy the blood supply to the fibroid, and this heat energy would have to go through the abdominal wall to get the precise target, to get to the target organ, rather. But does it change what the appearance of the abdomen looks like? The answer is no. If you see, this is one cut from laparoscopy. We see how long it is. Then these are from laparoscopy, which we mentioned was one option, and this is HIFU. So HIFU, nothing ever happened, no evidence. Yeah, so the skin remains the way it is. Next slide, please. So if we want to compare the recovery time for HIFU, post-HIFU, after HIFU treatment with other procedures. So we see that HIFU, the estimated recovery time remains the shortest here, which is 1 to 2 days, as against myomectomy and hysterectomy, which is 4 to 6 weeks. Yeah, so it's a very short period of time. So this is our Fibroid Care Center experience, our Nigeria experience. So HIFU treatments currently, as of today, we've done about 891 treatments for fibroids, and about 780 are for uterine fibroids alone. About 76 are for adenomyosis coexisting with fibroids, and about 35 of them are just treatment for adenomyosis. Frequently asked questions, we've answered some of them, but we'll just go over them briefly. Does HIFU cause cancer? No. Does HIFU affect my fertility? The answer is no. Rather, the reverse is the case. It preserves fertility. Remember, we said it's uterine sparing, so it preserves fertility. How do I begin? I find this question very interesting. Yeah, right? Okay, yes. So it's very interesting. So how do I begin? So the first step is to book for an inquiry session. Just indicate your interest. You can do that online right now. You could send a private chat. We would follow up from there with your name and your phone number and your location. We get someone to reach out to you so you have an inquiry. It will be individualized because you're telling us your story, like we're hearing what your story is. So you have an inquiry session with a specialist who would answer all your questions about HIFU. And after that, you'll be scheduled for an initial consultation to speak with a doctor who who is a HIFU specialist. So who would ask you to do MRI, maybe after taking your history, and then would go on from there. He plans your treatment, and after that, you do some blood tests, and we do the HIFU treatment. So that's how to begin. So the first step again is to schedule an inquiry session. Remember, I mentioned that you can send a private message with your name, number, and location to on the chat box, please. We'll take that up from there. Can HIFU be repeated? Yes, if needed in the future, it could be repeated. So what happens to the fibroid after the HIFU therapy? We've talked about it. We said the body's immune system takes care of the dead tissue by shrinking them, because it tries to, I want to get rid of you. You're dead. Go out from here. So it begins to shrink and reduce in size. And shrinkage rate following HIFU treatment for the first 3 months, it could be as good as 11 to 33%. At 6 months, it could be at 43 to 51%. And at 12 months, it could be as good as 55 to 70%. So imagine if you achieve 55 to 70% of shrinkage, of course, you decline to be set free from symptoms, obviously. Next slide, please. I think we should start all over. Okay, so well, in conclusion, uterine fibroid is common among women of reproductive age, especially Black women. So with the right information, medical guidance, and community support, you can navigate the challenges of fibroids and adenomyosis and lead a healthy, fulfilling life. Next slide, please. Yes, this slide is very important. This is a quote by Williams Osler. A good physician treats the disease. The great physician treats the patient who has the disease. So we are the great physician because we individualize patients' care. So we don't just treat fibroids, we don't just treat adenomyosis, we treat emotions. So we treat you as an individual, everything about you, including the disease itself and also your emotions too. We really we do that here. So that's what we do. Thank you.
Thank you very much, Nurse Joy. I don't know about you, but I had a great time. I learned a lot. So if you have your questions, please let's take your questions. And if we have questions from our online audience, please can we have them so we can read them out? Do we have questions from you? Okay, go ahead.
Good question. Yes, good question. So if you take out your phone and check the cheapest HIFU center for fibroid treatment in the world, you see a lot, but 3 of them stand out. First, you see Turkey, you see China, and you see Nigeria. And for Nigeria, it is Fibroid Care Center, Lagos, and Abuja. But if you check the cost for Turkey, it's about $7,500 to about $10,000. If you check the price for China, it's about $4,900 to about $6,700. So if you convert it to Naira, the first one is even above 10 million. So currently at Fibroid Care Center Nigeria, cost is 2.5 million. That makes it the cheapest in the world. Yeah. So that's the current treatment and cost for fibroid.
Takes care of everything from the beginning stage, where you do the MRI, it covers everything, and the blood test.
Okay.
Does that 2.5 cover everything?
So the 2.5 million naira is for the HIFU treatment.
Only.
Yes.
So all the other things you need to do, you pay different.
Yes. So remember we said it starts up with a consultation with the doctor, and that's charged at about 100,000 naira. For MRI, as of now, we do not offer MRI services. So that services is usually sorted outside, but we have good centers we could refer clients to if they want to. Yeah.
And the blood test can be done here.
Yes, the blood test is usually done here. Blood test and colposcopy.
Second question.
Okay.
So a patient who has maybe like 10 fibroids in her stomach, maybe some are big, some are small, and one procedure treats everything?
Well, the answer is yes. It's possible for one procedure to treat everything. But the treatment plan is usually determined by the MRI. When the doctor sees, assess the size, their numbers, their location, the doctor best discuss what the best treatment approach would be. Or if just, okay, 10 fibroids, one session, yes. There could be reason why some patients would require 2 sessions, even from the get-go, of which will be discussed at that instance with the client to say, okay, because of these reasons and this, it might be best for you to have 2 sessions. But yes, fibroid HIFU treatment can treat 10 fibroids from the get-go. It's possible. It's still the same principle that applies to the first one, the same principles. So some factors could be put into considerations, like their sizes and all, before the doctor will determine, okay, would these 20 fibroids be treated just with 1 session? Is it possible? Or is it best for you to have 2 sessions? So all those are determined. So it's just the same principle applies. Yeah.
Yeah, that question. So I've been told.
Okay.
Ladies in their so nowadays menopause comes early for some people. But I've also heard that the older you get, and maybe when you get to menopause, that the fibroid can start shrinking. I'm not sure if I'm saying this correct. Something like that. So is that true? In that case, you won't need to do the HIFU.
Well, that
on its own, it can start shrinking. I don't know how.
Yeah, that is not completely wrong. Yeah, it is true that for some women, when they go into their menopause, the fibroid starts shrinking on its own because of the fall in hormones like estrogen and progesterone. But it is not the case for all women. So there are women who even they have attained menopause and they're having symptoms, or terrible symptoms from fibroids, like they're having bad symptoms of fibroid and they have to treat. So in some women, yes, but it does not apply to all women.
The women of yes, and women of yes.
Okay.
How do you know if it's shrinking?
Okay.
How do you know? So maybe you can do a scan.
Yeah, I think you've answered that already. So there are ways in which fibroids are diagnosed, and we'll talk about some. MRI is one, scan, or having an ultrasound scan is one. So if you have those diagnostic procedures, you could check the sizes of the fibroid compared to what you had before and what it is currently. So yeah, it's possible. And even maybe the abdominal size for people who have big fibroids, they could start to see that, oh, their tummy is reducing, and so they would know that, oh, okay, it's shrinking.
If you have questions, go ahead.
Very valid question. So a lot of women talk about fertility after HIFU treatment. So the goal of HIFU treatment is, one, to reduce symptoms, and also, because it's uterine sparing, of course, to help improve fertility. So usually after HIFU treatment, there are a series of scans that are done to check how the fibroids are reducing, because the bulk of the work comes with the body's immune system, how fast they are absorbing those dead tissues. Okay, so usually within 3 to 6 months, to be precise, within 3 to 6 months, a lot of women embark on their fertility journey. So the first scan after HIFU treatment is at 3 months. So when you have the HIFU treatment scan at 3 months, remember we mentioned that shrinkage rate at 3 months is around 11 to 33%. Yeah, so the doctor will determine, and also the location of the fibroid. So that helps the doctor to determine, okay, you're good to go at 3 months, you can. So usually 3 to 6 months after HIFU treatment, a lot of women would go on with their fertility treatment. Okay, yes.
The stereoscopy that sometimes, because fibroids, they are negative, just like you said, come are inside where the baby should. So with the treatment of HIFU, they want also to look inside your uterus with the stereoscopy to be sure that it's not when everything happens, get pregnant and then it's carrying them. So to do a hysteroscopy also, twice within that, so that you should get pregnant after that.
So my second question is this: what's the size range? We treat any size of fibroid.
Okay, the answer would be no. We don't treat any size of fibroids. Okay, but usually the size of the fibroid would not only determine if the HIFU treatment will be done or not. There could be other factors like, okay, is it compressing any nerve? Is she having any other complication because of the bulk of the fibroid? So all that are put into consideration. For HIFU treatments, we've done HIFU treatment for tummy size as big as 34 weeks. That should be around 8 months pregnant. Yes, so I said yes. So not just, we don't just use the size to determine if fibroid size could be smaller than 34 weeks, but they could be, yes, they could be pressing on things that need urgent relief. Yeah, so in those cases, and would say that HIFU treatment might not be best for that client because they need immediate relief from that compression or from that situation so that it doesn't cause further damage.
Yeah, maybe I add that.
Yes, please.
One of the information we get from the MRI also what we call the blood supply to the fibroids. So because you know the way she said HIFU act is going to burn off the blood supply and kill the fibroid. So if the blood supply is too much, we don't want HIFU because it's going to take a lot of it. So we will not. Fortunately, it's the hypointense fibroids that is common in this environment. So HIFU is very good for our fibroids. So, but when we see hypointense fibroids, that one that the blood supply is too much. Yeah, we don't, because that also might be an indication that it might be something going on there. So we don't want the MRI does that as well.
Yes, I think we should take our online questions. Questions from online. Yes, please. No, sure, you can see it from that. You can read out.
Okay, so
It's not my
yeah,
phone.
okay.
All right.
Okay.
I think we
Okay.
should take our questions.
Thank you.
Now, one of the questions I want to ask you to answer in 3 to 4 months, how soon can client get pregnant?
Okay.
Then having done lap myomectomy, open myomectomy, and hysteroscopy,
Okay.
is that client eligible for HIFU or it is based on the MRI report?
Okay. And thank you for your question. So having done laparoscopy and open myomectomy is not hysteroscopy is not an instant contraindication for having HIFU treatment done. Remember, one of the criteria for clients who would qualify for HIFU treatment is a safe acoustic pathway. We want to make sure, because we know that one complications from open surgeries would be additions. You could have bowel addition, you could have additions of like the bladder adhering to the uterus or surrounding organs. So if the acoustic pathway is safe, then yes, that client would have. So we would first of all do what we call a simulation first, like a mock, let me put it that way, to make sure that, okay, there are no bowels that would be obstructing on the way, and there are no other additions in the abdominal area that will be obstructing that pathway, because we need that pathway free, because we want to target the fibroids. We're trying as much as possible we're not targeting other structures aside from the fibroids. So if the acoustic pathway is free, yes.
Okay, what is the age limit?
There is no age limit for HIFU. Okay, any clients can have HIFU, whether young or old. We've done HIFU treatment for clients who are 19, they are 19, and then other clients too as well. Provided there is an indication, a reason why HIFU treatment would be done, that's either fibroid or adenomyosis. And the aim of doing HIFU is also to improve the quality of life. Yeah, so even if the client is older and the client is having heavy menstrual bleeding and other symptoms that comes with fibroid, of course, we would treat.
Back to what you just said to her question. Is every client eligible for hysteroscopy, or is it a norm that once you've done HIFU, you have to do hysteroscopy post HIFU?
Well, it's not really like a number. We try because we don't want this story that if there's something left in your endometrium, that's how you are thinking. Because some people even have polyps, you know. So we want to clear everything away so we don't come back to. So the majority of the people, almost 100% have this. But especially people who have fertility, who still want to have children, it's like it's 100 compulsory that they should.
Okay, in a young lady who is not married, early 30s, would you advise she do the hysteroscopy first or HIFU first?
That's a nice question. We will still advise that you do HIFU first and then do hysteroscopy.
So that means you can't do twice. You can't do it before the HIFU and after the HIFU.
Well, if you want to do that, but that's double cost. We really don't want to do that. So we will as much as possible. Because sometimes the stereoscopy might need to be repeated. If you have a submucous fibroid that is big, and you know hysteroscopy, you are playing in a very small space. So if, for example, they cannot take everything in that space out at a sitting, then they might need to come back to remove it again. So there's no point in doing before and then coming back again after.
Sorry, sir, how soon would that be?
Oh, they usually do 2-3 months.
After 3 months, then you come back for the hysteroscopy.
For the stereoscopy. They will place you on Zoladex to reduce the blood supply to whatever is there. Then you extrude.
And I want to say also, let me start. I want to say thank you to Dr. Jai. I'm one of his staff.
Thank you,
Oh, I've always heard about you. You're welcome, ma'am.
Why I'm here this afternoon is to thank Dr. Ajay for the experience I had here. Come by January. And I'm grateful to God. My daughter, I'm here on behalf of my daughter, she has fibroid, and I want a solution to her problem. That's what I came, and I'm supposed to say one-on-one after this. I mean, after this forum. Now, with my experience here and what my daughter is going through, not even here, abroad, the day I realized that what I gained here, I can't get it anywhere, was the day I spoke to them, and I was very aggressive when I was. I have to put my mouth and tell them everything we're doing here, even though it's online, I have worked in an endoscopy, gynae endoscopy clinic, and based on that, they were going to mess up my daughter, and we stopped. Because I told them I have the experience, I have an endoscopy clinic, and I want to thank you, sir, for bringing all this experience back to Nigeria. You have wonderful doctors, wonderful staff working here, and I'm grateful to God I work with you. Thank you so much.
Thank you.
Thank you. Okay, so let's take some questions online.
I have some here.
Okay,
So I'll just
I think it's
read
the same,
here.
right?
Yes.
Okay.
Will there be any tendency for the fibroid to grow again sometime after the treatment?
Okay, well, it's still an information that is available online. If you check the rate of reoccurrence of fibroids after HIFU treatment versus open myomectomy, that of HIFU is almost non-significant. So the rate of recurrence, yes, it could, but it's not a common occurrence.
Who does HIFU, gynecologist or radiologist?
Okay, so a HIFU specialist does HIFU. So most of the time they are gynecologists, but not just gynecologists, they are HIFU specialists. That means they've had the training to carry out HIFU procedures. So maybe in the future, I don't know if in some part of the world radiologists are
Interventional radiologists.
okay in some parts of the world. For our Nigeria Experience Fibroid Care Center, experience is done by a gynecologist who is a trained HIFU specialist. Oh, okay, yes, please.
Because HIFU can be used for other things.
Yes.
From fibroid, or especially people who are using for cancer.
Yes.
So usually those are interventional.
Okay.
But for us, since we are using it only for gynae,
okay.
so it's gynecologist and but they have to be trained.
Of course.
Then can a pregnant woman do the procedure?
No, I'll just be straightforward with that question.
And if someone else is asking, I know you already answered it, but just for the sake of the person, is can we get a rough estimated cost of HIFU treatment?
Of course, you can. So that's why we talked about the inquiry session. You can send a private message to Oluwa, to the Zoom inbox, and you have an inquiry session. It's free of charge. That's very important. So it's free of charge. So you get all the breakdown. So I already mentioned that HIFU treatment has now cost about 2.5 million. Initial consultations about 100,000. And after the MRI, your treatment plan would determine what the overall cost would be.
Okay, so we have another question. Is HIFU useful for all type of fibroid in terms of size and location?
Well, I would say yes and no. Okay, let me pick no. Let me pick no instead. So in terms of size, we already talked about size itself would not be the only reason why a client would not have HIFU treatment. There could be other reasons, which we mentioned. Then when you talk about location, the only kind of fibroid that HIFU would not want to treat would be the one that is inside the uterus. So that is why hysteroscopy is inside the womb. Let me put it like that. Let me not use uterus. So inside the womb, the one inside the endometrium, also called the lining of the womb, also called where the baby stays. Let me put it that way. That part where the baby stays is a very delicate part of the uterus. And remember how HIFU works? It uses heat. So if heat gets to that part, of course, it could scar it. So for fibroids that are inside that part, HIFU, we would not do HIFU for that fibroid. But if the client has that kind of fibroids and fibroids that are in the muzzle, fibroids that are outside or towards the outside lining of the uterus. So let's say this client have the 3 categories of fibroids we mentioned. So yes, to HIFU treatment to tackle the ones outside, to tackle the ones inside the muzzle, but for the ones inside the uterus, hysteroscopy, which is mostly usually part of the treatment plan, would remove that.
But also let's add that even for such fibroids, surgery is not good for them. Open surgery is not good for them.
Yeah.
That's why some people after open surgery, they can't have babies. They can't even menstruate after open surgery because they have that kind of fibroids that somebody has cut into and then they form scars after that. So hysteroscopy is the best
option. Yes, that's true. So hysteroscopy will be the best option for fibroids inside the uterus. And we've seen some clients, funny enough, who comes in and that is just the only kind of fibroids they have, the ones that are inside the uterus. They don't have other classifications of like other types of fibroids rather. And we just ask them to just go for hysteroscopy. Yeah, and that takes care of it. Okay, so I have like a video in my mind that I'm going to play for you on how hysteroscopy works. But if you want to see the real life video, you can just check online later. So hysteroscopy is a minimally invasive procedure. So it's done using a camera. So that's where the scopy comes about. So it uses a camera and it's as tiny as a pen. Just imagine a pen, maybe slimmer. Maybe slimmer. So it's as tiny as that. So first of all, they want to gain access to the uterus. They go through the vagina, the cervix, and the uterus. And hysteroscopy is not a blind procedure, so it's done on that direct vision, like you're seeing what it actually is. So on a screen, so you're seeing what the uterus looks like. So once that camera is introduced, they first of all check the whole of the uterus before they start checking. They now start checking, okay, are there fibroids inside? Are they the ones? So if there are fibroids that are inside the uterus, they now introduce, the camera is still there. It's not going out. The camera has to be there all through. So they introduce another instrument that is still as tiny as a pen that will still go through. And that instrument helps to shave off, I'll call it that, shave off the fibroids, like take them out. And they are brought out. So the client gets to see that, oh, okay, fibroids are taken out. This is it. Or maybe they are polyps or, yeah. So client gets to see what was taken out. So that's how hysteroscopy works. Well, no, I would say no. In our experience here at Fibroid Care Center, it is not painful. Other parts of the world, the stereoscopy can be done as a table procedure. Just do it, and the clients might be screaming and all. But at Nordica Fertility Center, our patient experience matters to us. So it's done under general anesthesia. So our clients are sleeping peacefully while the procedure is on. Short lasting though, not the kind used for major surgeries, just for a short period of time. Let's say about 20 to 45 minutes. Yeah. Yeah, short.
Okay, I'm not sure we have more questions. Oh, she's
showing
okay,
yeah. So yeah, so this is a picture of okay. So this is like the camera. You see how tiny? I think it's even tinier than a pen, than a writing pen. So here, this is the uterus. So this looks like there's something in there. So saying there's something in there, but they're going to check the surrounding structures, check the depth of the uterus, check if the corneas are open or if they're blocked. And yes, so they still introduce the instrument here and take this out. So it's called like fibroid resection. You take it out. So once they take it out, you would see them. And the images are magnified because on a norm, the uterus, I would usually describe it as a palm, like it's kissing itself. So it's just glued, like not glued, but it's just like this. Yeah, so together. So you have to use fluids to expand them to be able to see. And because it's a small space when there's no pregnancy. Yeah, it's a small space. So the image are magnified. So you're seeing clearly, like it's so bold that it's as if the person is just standing in front of you. Yeah, so that's how stereoscopy. Yes, proudly, yes. Now we've done over 10,000 cases of endoscopy. Yeah, stereoscope. Yes, we do.
Okay, thank you, Nurse Joy. That's really been insightful. But I don't know if we have more questions in the house, but for online, I think we've exhausted their question. But I have a question for you, Nurse Joy.
Okay.
So for someone that has been anticipating to join Open Forum today, what would you say to the person having listened to you and the person is in that place of taking a decision, or the person has fibroid, probably even online, and the person is saying, what do I do? How do I take my next step now? Like, what would you say to the person? The person is just at that place of taking a decision, and even what's the right decision to take right now?
Well, when it comes to taking decision, I would say what we do as healthcare practitioners is to provide the right information, and we allow patients they make an informed decision. Yeah, so we've talked about HIFU. We've compared it to like the open surgery, which you said is the most commonest. And then if we look at the complications when it comes to doing open surgery versus HIFU, I would usually say, because I've really never seen in experience where there are any major complications following HIFU. So HIFU still remains the best option. But we've mentioned at the course of the discussion that not everybody will have HIFU treatment done. Suitability is very important. So we wouldn't say because you have fibroid, you must have HIFU done. Not at all. So have the inquiry session, so you get further information, you get to speak with a HIFU specialist, and then you can make an informed decision. But HIFU is still, I would say, relatively new, in Nigeria. Okay, we have about 36 states in Nigeria, and we have just 2 centers in the whole of Nigeria that offers HIFU treatment. That is Lagos and Abuja. But I would still say location is not a constraint, because if you imagine traveling to Zamfara and traveling to China, if you want to compare the fee, then you should know what it is. So it's not so I think awareness, so we still need to create more awareness so people are aware of what HIFU treatment is all about, and especially doctors. It is sad to say that some doctors, I would say, I would not want to really say they don't have the right information. Maybe, but because it is different from what they sell, which is open surgery, and a lot of people just want to let's buy into that, and so they tend to like preach against HIFU. So imagine we have 36 states, and we have hospitals in those 36 states that offer open surgery or other options. like open surgery and myomectomy and other options, and we just have 2 out of 36 that offers HIFU. So it's like the pressure, so to say. So it's like 34 against 2. So the information is not well passed by some doctors. So they just try to convince patients to buy what they sell, which is open surgery. But I believe that in time to come in the future, there will be more awareness and people would embrace it. If we remember the slide that shows HIFU, the global record of HIFU treatments that I showed, like a pie chart, it showed HIFU in 2010 and to 2022. So you see that increase. So the knowledge is there, like it keeps increasing and over time. And I think that's what will happen in Nigeria too. So it's for us to give out the right information. So coming back to your question, yes. So provided the information, the right information needed, and some informations are online. Very good informations about HIFU procedures. It is not a new technology, like I said, yeah, but maybe in Nigeria, almost 5 years, not still new, but relatively new though. So yeah, so just first of all, have an evaluation done by having an inquiry session, having a consultation with the doctor. Then the doctor will be able to explain if HIFU is even suitable for such clients or not. So anybody that is just at the wants to make a decision or at the point of decision making when it comes to HIFU treatment, I just have one word for you. You are not alone. There are a lot of people, a lot of women that are there and at that stage. And I'm sure you're going to make the right decision based on all the information you have.
Okay, I think Mr. Nora has a question. Okay, sir.
Has it been like most women who have gone through the process? You know, when you had psychologists speak at your presentation, you find out that real problem is the quality of life of the person before and after. But from the experience, this highlight one.
Yes, and the quality of life after HIFU is good, like really good. Because I know my MD sir, he's a very I don't know the word to put, how to put it, but if HIFU was just a mere mockery, I am very sure that he might not have thought twice and closed down the place. So quality of life after HIFU is really good, and currently we are compiling a data that can be presented on quality of life, because we usually, it's a very actually a very important aspect of the HIFU treatment. Before the HIFU treatment, we have a questionnaire that talks about quality of life. Let's know what your quality of life is even before the HIFU treatment. And each time the patient comes for scans after the HIFU treatment, at 3 months, at 6 months, at 9 months, at 12 months, you have a questionnaire you fill each of the time, same questionnaire. So that helps us compare what your quality of life was before, at 3 months, at 6 months, at 9 months, at 12 months. So currently we're compiling all those data together, and I'm sure when they are ready, it could even be published. So a lot of people have positive experiences about their quality of life post HIFU. So I'm usually glad oftentimes when I hear, my tummy is reducing, yes, that's a good, my period, it has gone back to normal, or the flow is reducing. But it is very important to note that it's usually a gradual process. It is very important. So that helps to manage patients' expectations after HIFU treatment. So after HIFU treatment, we don't expect that the fiber is just going to disappear or shrink instantly after HIFU. No. So that is even why we have series of scans that's why we have series of scans to check the progress, how the fibroids are reducing, and patients are able to even verbalize wellness, their experience. And I'm sure we're going to watch some testimonials from patients too.
Okay, just right before we watch it, we still have more questions online. So, Ms. Joy, I hope you're ready. I have them here, so I'm going to read them to you. Can I qualify for the treatment? I had a CS 14 years ago, and the size of my fibroid is like 6 months pregnant woman. What's your answer for her?
So 6 months pregnant woman should be around maybe 6 months, and some weeks. 20 weeks. Okay, yeah. 26 weeks, yes. 5 months is 20 weeks, yes. That's 26 weeks. I will mention that we've treated women that have fibroids as even big as 34 weeks. Yeah, so yes, but that alone would not determine if you would be qualified for the treatment, as we mentioned time and again at the course of the presentation. So having a cesarean section 14 years ago does not disqualify you from having HIFU treatment, but would want to make sure that still the acoustic pathway is safe, there are no adhesions in the abdominal area. Then if that is settled, then yes, you can have the HIFU treatment done. So yes.
Okay, what is the size of fibroids that HIFU can take or treat?
HIFU can treat fibroids as big as 34 weeks that we mentioned earlier. I don't know if Dr. Abayomi Ajayi, do you have any contribution to that?
Right. So what normally you say is that if you're looking at one single fibroid, how big it can be, you can keep centimeters continuing. So when you get over 20, you spend a lot of time for minutes.
Yeah.
Challenge.
Yeah. So is HIFU useful for all type of fibroid in terms of size and location?
Sorry, it's fibroid. Maybe.
Okay.
When was the question asked? I don't know if it was.
Okay, let me ask this. Please, what does the fibroid process entail, particularly the HIFU treatment, especially the cost implication?
I think we've answered that already.
Okay, that means
please.
We have exhausted our questions.
Okay,
there's one other. Yeah, there's one. The presenter. Which one?
Okay, the presenter.
The presenter mentioned that reduction rate of size after HIFU is 55% after 1 year. Does it mean it still persists but only reduce?
Okay, so maybe we'll go back to, that's not exactly what I said. Maybe we should go back to that slide that talks about frequently asked questions. Okay, here. So we mentioned 35 to 70%, not just 55% is a range. So 55 to 70%. And what was the question that followed, please?
I'm sorry.
What the person is asking, if the fibroid is still there,
yeah,
it shrinks that much.
Does it mean it still persists?
So the point is that people are making that, like my method.
Yes.
For this one, they're not taking it out.
Okay.
Shrinking it out.
Yes, I understand. So if we say 55 to 70% shrinkage at 1 year, so that means there's still some percentage left. So that means the fibroid is still there. So it continues to shrink. So this is just like a shrinkage rate for 1 year. Yes, so it continues to shrink. But the most important thing is that as this shrinkage occurs, because what would even cause the symptoms of fibroid most of the time could be the size, could be the location. And so once you're achieving this shrinkage, the fibroid begins to shrink, is as good as your symptoms are also reducing and would resolve in most cases even completely. So it does not affect, so whether they are there, some people have fibroids and they still even get pregnant. So it does not mean that for people who are interested in fertility, for instance, that the fibroid has to have been completely shrunken before they could go for conception. Remember, we mentioned earlier that even as quick as 3 to 6 months post HIFU, the doctor can evaluate you as being fit for having fertility treatment. So fibroid continues to shrink even after that.
Okay, so we're going to go into the theater room to check the machine shortly. Nurse Joy is going to take us to go see the machine. We're talking about the machine, right? If I'm you, I really want to see what it looks like. So yes, we're going to go to see it. But while we're going, our online audience will have to watch the testimonial video. Do you have more questions? They can, maybe he can. Yes, okay, awesome. So, but he's saying we have one other question. Nurse Joy, can you see it from there?
Yes, I think so.
Okay,
so when do you decide repeat HIFU treatment? Well, sometimes, like we mentioned earlier, that decision could even come from the get-go, even before the start of the HIFU treatment, where we said there are some clients who would require two-stage HIFU treatment. So that is dependent on what the MRI says, the review, the size, a lot of factors. Yes, so that could even come from the get-go. So the doctor, the HIFU specialist would say, okay, it's best to have two-stage treatment. Maybe we could look at the second stage around maybe 6 to 9 months after the first HIFU treatment. Yeah. Then sometimes maybe in the future, in cases where you have fibroid reoccurrence, but remember we mentioned that that rarely happens, but clients can have a repeat treatment in the future. Yeah, if that happens.
Okay, I think he has a question.
Yeah, sorry. Thank you very much. Actually, I think this is the first time I've been hearing about it. And I want to ask, as part of the awareness, is there going to be a collaboration with religion center? Because know that very easy for that cycle to communicate things to them and they will listen compared to the people on the street.
Yes, yes. Thank you very much for that's like a campaign idea, like yes. So we are actually doing that. So we have a team that usually goes to churches. They just obtain concept to come and have a presentation with them and tell them about HIFU. Yes, it's an option that and we also go for conferences to tell people about HIFU, and we use all other mediums available, but we know that we still need to be very audible enough to talk about it more. And also that is why we also have you here. Yes, that's why we have you here, and also our online participants as well. So some people who might have attended the program today they might not even be the beneficiary of the procedure. They might have come on behalf of someone, or they just want to get information about how it works because to them they've never heard it before. So it's still on us to say, okay, haven't gotten this knowledge, why not pass it on to others who might also need it? So I think, yeah.
Okay, thank you very much. If we don't have more questions, I think we should go on the tour now. Mr. Manuel, are you ready for the online so that they can as well see the, yes. Okay, let's Joy, please let's go. Oh, you want to say something? Not yet.
I would love to go there, but as it stands now, yeah, there are other things that people do that they call HIFU, or it's not HIFU.
There's a question.
Yes.
Oh, okay.
Is HIFU?
No. The second one.
I was recently diagnosed with fibroids and I am ready to commence treatment. However, I would prefer a non-surgical option. I had an ectopic pregnancy in 2012, which required a cesarean, and a surgery. I would like to know if I am eligible for HIFU treatment. Well, it will be best for you to have an inquiry session. We're going to drop our contacts here. So please do well to reach out to us.
The contact has been dropped.
Okay, I think the contact has been dropped. But know that because you've had a previous surgery, that does not disqualify you from having HIFU procedure. But rather, you need to have a consultation with a HIFU specialist and do some investigation, like the MRI scan, just to make sure that there are no uterine adhesions that will be scared of, and possibly you have a simulation to make sure that the pathway is safe. So once those are ascertained, then yes, you should be able to have the HIFU treatment done. So again, you having had a previous surgery in the past does not disqualify you. So yes, it is possible that you could have HIFU treatment.
Okay, thank you very much. We're going into the tour now, the center tour, and yes, so we go and see the machine. But when we're back, we'll watch the testimonial.
There.
Yeah. Okay. He said you can. You can. All right. So please come.
Okay, so this is the exact replica of what we saw in the picture. So this is what the HIFU theater looks like. So this is the PlayStation where the HIFU specialist stays. And here you have what happens here. So this is
People are watching. I want to go.
Oh, okay. So you're welcome to the. So you're welcome to the HIFU Theater, Fibroid Care Center, Nigeria, Lagos. So this is what the HIFU Theater looks like. So here is the control station. So here we have there's an ultrasound, and we also have this screen that displays the MRI. So the doctor is looking at the MRI while working, and this also controls the HIFU machine itself. So this is what the beautiful and wonderful HIFU machine looks like. I'll usually describe it as wonders in our time. Yeah, so this is a very good technology. So this is what the machine looks like. So the patient's tummy or abdomen fits in here. This is what we call like the transducer. This lying face up. No, lying face down. So remember we said the patient will have to lie in position. Yes, lying face down. Yeah. So yes, so that's just one thing. So this is really the recovery bed, and we also do the pre-HIFU preparations here, and post-HIFU preparations. The patients are just meant to recover, just like 2 hours after yes. So this is what the HIFU.
What about water?
Yeah, so this is water chamber. So this controls the inflow of water to the machine and also the outflow too.
Mr. I have a question for you. Thank you very much. So I wanted to talk about the angle that sometimes here, music is being played live for the client. So what's kind of about it for that? Because I know that much, but
yes, so that's so this environment is not a serious environment, so to say. So once our clients, our patients are very comfortable, so we have a speaker. Sometimes they could choose to play their own preferred songs. Yeah, because remember, the several things not done with general anesthesia, so the clients are kind of awake, still with conscious sedation, so they're just sedated to be calm, but they are awake and they can communicate what they feel at each time. So the music kind of helps everybody to relax, the patient, doctors, nurses.
What about the water?
Okay, so the water chamber is controlled from here. So supplies water to the machine. So during the hand treatment, this part is filled with water. It's usually cold. So that kind of helps to reduce the direct heat on the skin. So that is also why it is not common to have skin burn, because they're not just giving the heat energy. There's also a way to control it so that it does not affect the skin directly. So like a pool of water, we just on the patient's side. Yeah. So the water inflow and outflow is controlled from here, supplied by tank to the machine, then it fills up, then the drain, then to that section. Okay, so yes, so how long the time for it? As long as the HIFU treatment lasts, which is usually 1 to 3 hours. So in some cases where the fibroids are maybe small or maybe just 1 or 2 or 3, it could even the treatment itself could even take less than an hour.
but usually we would say 1 to 3 hours. So in cases where we're treating maybe adenomyosis, persistent fibroid, those treatments will take a longer amount of time. Yes. Okay, so any question online, online viewers about the
Okay, there are no questions. Let's just go on to the testimonial.
yes.
Thank you, Namaste.
You're welcome.
Hi, good morning, good afternoon, good evening. My name is Aisha, and I would like to share my HIFU story with you. Well, in 2020, I was diagnosed with fibroids. I couldn't take the news because it wasn't 1, it wasn't 2, it wasn't 3, it wasn't 4, it was actually 5. And the two largest were between 9.5 by 8.4, while the second largest size was 7.5 by 6.2, I guess. Then every other ones were smaller sizes. It was a journey of pregnant woman, sorry, be careful there because I have a bulky stomach. It was quite noticeable when I'm coming, and I hear people say, be careful there, you know, you're pregnant and others, but I know that I wasn't pregnant. I really wanted a solution, and that was when I started my fibroid journey. I visited different hospitals recommended by friends and families. And I remember very well when I finally made a decision that, okay, I'm settling with so hospital. I said within myself that I'm ready. So I met with my boss and I discussed with him that I would like to go on leave to take care of myself. And he was shocked, like, oh, in this age and time, you want these options when there are better options. And I was like, no, that even when my mom had hers, because my mom was actually diagnosed with fibroid back then, but we finally lost her. Ours was even quite pathetic because it was heavy flow, and the menstrual days were like 7 days or more, I can't remember. And it's quite heartbreaking when we finally lost her. That should be in 2010. So when I told him about this, and he was shocked, like, oh, So you're not aware of HIFU surgery? I was like, no, I've searched the internet. There's nothing like that in Nigeria. And he said, no, that there is one in Lekki and people have been going there for HIFU surgery. I was shocked, like, okay. So he gave me the address. I went online, I Googled it, and I went there. That was Medical Fibroid Center in Lekki. When I got there, I made inquiry, and they gave me the bills of what I need to cater for. I went back to the office and I gave him the news that I never knew about Medical Fibroid Center in Lekki. And he said, yes, there is, because there was someone who mentioned it to him. And he feels that it's something that every lady needs to know about if they are in that kind of condition and they need a solution. I was very happy when my boss said it is a done deal, and I went for the HIFU surgery. I was very, very happy. Now, in 2022, November, that was when I finally settled a date for the HIFU surgery. And I remember when few days before then, I was asked to do a lot of things in preparation for the HIFU surgery, which I followed religiously. I just wanted a solution because I've had several miscarriages, and I don't know. Friends will tell me, don't go for surgery, try to manage it. I know one Yalagbo, I know one herbal seller that is very good. That's our specialty. She will give you all kinds of concussion that can help you to shrink. And I tried that out before I just gave up finally, like there's no solution of such. Then friends and family also discouraged me about the surgery. That most people who finally go for the surgery are those who have children already. So if you have no issues, you shouldn't even try the surgery because it will be very hard for you to conceive afterwards. So I just felt to myself that so many complications after surgery is not something I would also like to try. So in 2022, November, I settled for a date and I went for my HIFU surgery. Like I said, in preparation for the HIFU surgery, I was asked to do a lot of things before the session. So that very day, I came quite early as I was asked to. And in few hours, I was done. I think the process was just like 2 hours, right? Yes, in preparing me for the HIFU surgery. And when I was done, I was asked to lie on my tummy. So I laid on my tummy for a few hours. Then I was asked to go. And in a few days, I was up already doing a lot. Even that very day after the surgery, I could do a lot. I went back home. I went back to my house, took care of myself. And 2 to 3 days, I was very fine, could take normal meals and others. Calls from the hospital as well, just like they want to know how you're doing, what's your well-being like. And it was really a support system that every human being would like to look forward to. It was quite interesting because they want to know what's the outcome. Are you better? Are you taking your drugs? Are you, hope you're following the rules and regulations we've given to you. And it's something interesting. Excuse me, please. So in January, I had a delay in my period and I was like, oh, am I pregnant? And I checked. I bought a pregnancy test script and I checked I wasn't pregnant. So I just said, okay, let me just go to the hospital. A few days after I checked, I did a blood test just to verify and it was negative. So I went back home. I called Fibroid Center, Medical Fibroid Center, and I was told that, oh, it's normal. Just be patient with the process. Since you saw your period in November, December, and January, it's been delayed. I'm still fine. So in February, it came. A few days after, I guess. It should still be in that. Yes, in February, it came. So in February, I was okay. I just told my husband, please, let's take it slow. I want to heal totally. I want to just be fine. So, but in April/May, I saw a delay in period again, and I was like, oh, why is my period not here again? No problem. Let me check again. So I did PT, and I did a pregnancy test. With, during pregnancy test, it came out positive. I was like, oh, are you for real? Okay, it's fine. I went to the hospital and I did blood tests. Blood tests confirmed it again, saying that it was positive in May. I was so happy. I don't know. I wanted to scream. I wanted to do a lot of things. So I just thought to myself, okay, excuse me, I need to be careful right now because I'm actually pregnant. I don't need to do a lot of things. I don't need to stress myself and others. So I was being careful. In May, I was supposed to go in for after HIFU surgery checkup. I was actually asked, I was scheduled for May. I was scheduled for hysterectomy or something in May. So I thought to myself, I called the nurse, that's Nurse Anna. She told me, oh, since I'm pregnant, I don't need to go for that. She was really happy for me, and I was like, oh, that's because what they wanted to do is just to check the cervix, check the inside and all that. I said, oh, so it's not required any longer, and that was it. So I went for 3 months after HIFU surgery, checkup, 6 months after, 9 months after, and 1 year after. That was in November last month. So in all, the process, for once, even when I go for my ANC, that's the antenatal classes, and checkup, my doctor will always ask me that, my ferrin, because they've stopped fibroid. It's still there, but they are all dead. For once, no cramps. It was just a smooth journey. Unlike most people who still have fibroid. The fibroid are already dead because the process is slicing the fibroids and allowing it to shrink over time. And because the baby is there, the baby is, even when I went for when I started the antenatal checkup, antenatal classes, I remember very well the doctor, gynecologists, every one of them were like, oh, let's check, let's do this, and they saw fibroid. I said, yes, it's there, but I've done HIFU surgery, and they are dead. For once, they never gave me any painkiller to resolve any cramps or anything. There was nothing like that. It was just a smooth journey, unlike other people who had fibroid and they have to put them on a bed rest. In all, I would like to encourage someone out there who might be weighing different options on what's best option to go for. When it comes to HIFU, there's no scar, there's no need for blood transfusion, there's no, what's it called, delay in period, no. If you're expecting your period at a particular time, there's a date the doctors will have to check and see, so that when your next period is coming up, it will fall in place. Today, I'm pregnant and I'll be 32 weeks gone. I'm sorry, the light is off. You know now, they just see I'd like to show you this. It's my testimony, and I'm very happy about it. I want to say a very big thank you to all the doctors in Nordical Fibroid Center. Thank you so much for your time. Thank you for everything, your care. The care was too much. After the HIFU surgery, I remember this one will call, that one will call, Nurse Anna. Every one of them were calling. Sister Christiana will call, Sister Victoria will call, this one will call. Then I think Nurse Susu was the final stage for me to see the doctor and all that. They will call to check on me, and it was really a support system to heal one within days. It's something that I'm really happy about, and I'm encouraging someone out there who is also weighing options like, okay, what should I do? Like I said, HIFU doesn't require blood transfusion. There's no scar anywhere. Oh, I cannot go to the, I don't want to go to, I don't want to swim. I don't want to wear swimsuits because of this scar. No, it's just something you have to live by. And I'm very happy to share this with everyone out there. The best option is HIFU surgery. is an option that will give you a better tomorrow. Just like how I had my testimony. In November, I did the HIFU surgery. In that same November, I saw my period. In December, I did the same thing. So it's not something of delay that you'll be waiting for your period to come, or you have to use a particular medicine to make it to come. So I'm encouraging someone out there. If you're looking for a better option for your fibroids, please take HIFU. HIFU surgery is the best. And there's just one in Nigeria, which is Medical Fibroid Center in Lekki. I encourage you to visit with them, see what option they have for payments. I think they have payment instrumental and others. You can reach out to them and see how best you can have your HIFU surgery. Thank you so much for your time. Thank you for listening. Have a great day and stay blessed.
Having more of the pressure with that pressure. And also that location is very career so it must not be a work campaign, even now you don't even hold, it can be scheduled hold at your home. Canada, anywhere you are, and it's a inbox where you can have that. It's free to walk into our center. I think that we will the very last area and so you see, you check, I just check primary care and that transport is CRP and then there it's and also the flyer you can take off and then what happens we'll see. If you can watch now, what the basically, and people who want to see better communication, please I would advise or encourage you to opt for a review encouragement. And we want the result to be flexible. To opt for a review encouragement and we can take you to the around the ICU. Around the hospital right and also to just see I mentioned AA one of the more in Lagos walking, around Lagos and walking. Thank you. Also look at your remote manually, your consultation. Okay. You also that your consultation cannot you don't need to be kind of present for the presentation.
location. So what is most convenient for you? But for clients that are around Lagos, around Abuja, please feel free to have a physical consultation if that works best for you. Remember, we said location is not a barrier at all. So it is easy for you to travel from, I don't know why I like Zamfara. It is easier for you to, so it's easier, okay, let me use Kaduna. So it's easy for you to travel from Kaduna to Lagos or from Kaduna to Abuja than from Kaduna to China, to Turkey, to Malawi, cost effective wise. Yes, yes. It is even very important to say that even people from diasporas, they come to Nigeria to have HIFU treatment. It's a very important point to mention. Reason being that it's cheaper, cost effective. Let me use that word. Is cost effective. So even if they calculate their stay in Nigeria, their flight costs, and their other costs around the treatment, it is still maybe even times 2 or times even 3 cheaper. So they prefer to come here. So for our diaspora clients, you're not left out. We plan your treatment even before you arrive. So we already work with your arrival date, tell you what to do to make the process seamless. So when you come in, you just have a seamless process. So you can just have your treatments quickly and then travel back. Yeah. So please feel free to reach out. So our address is still currently displaying on the page. Yes. So Fibroid Care Center, Abuja and Lagos. So feel free to take a screenshot and then reach out to us. So we look forward to hearing from you and we look forward to seeing you in person. It has been a wonderful session. At this time, I would like to say, it pains me to say goodbye, but I would like to say goodbye to everyone and we'll see you soon. Bye, everyone. Thank you.